So in this video, we'll look at the femoral triangle and its anatomy and talk a little bit about groin swellings and hernias in the groin region. The first patient is a 43-year-old male who's been stabbed in the groin below the inguinal ligament and is bleeding profusely. He's unable to straighten his knee and complains of numbness over the front of his thigh. I'd like you to pause the video and see if you can work out the anatomy of what is going on in this case and think a little bit about the area of the groin and the femoral triangle. The femoral triangle is an area in the anterior upper thigh bounded laterally by the sartorius muscle, medially by adductor longus, and superiorly by the inguinal ligament. Its floor is made up of the iliacus and pectineus muscles, and its contents from medial to lateral are the femoral vein, the femoral artery, and the femoral nerve. It's important to remember that the femoral nerve lies just outside and lateral to the femoral sheath, which contains the femoral artery and femoral vein. In this position, it can be accessed for regional nerve blockade. Both femoral nerve block and fascia iliaca nerve blocks are discussed in more detail in our lecture on the femoral nerve. Let's move on to another case, a 56-year-old male patient who presents with an intermittent swelling to the left groin region. Again, stop the video and see if you can work out a reasonable differential diagnosis for groin swellings. When we're thinking about groin swellings, it's worth having some sort of classification in mind, and I'm just going to present to you one idea to help you remember the many things that can cause groin swellings. So of course we can think about herniae, and there are two types of hernias to think about here, inguinal and femoral, and of course the inguinal hernias can be direct or indirect. Vascular swellings can also occur in the groin area, such as a sphena varix within the scrotum or a femoral artery aneurysm just below the inguinal ligament. There may be lymph nodes involved, either deep or superficial. Remember that the node of Cloquet may be associated with disease of the gland's penis, such as penile carcinoma. And finally, you may have other swellings such as hydroceles, undescended testes, which are more prone to malignancy, and then a psoas abscess, which may present as a swelling below the inguinal ligament. And of course, remember that the iliopsoas makes up part of the floor of the femoral triangle. When we are thinking about groin hernias, we need to differentiate the three main types, which are the indirect, direct, and femoral hernias. So when we look at the two inguinal hernias, both arise above the inguinal ligament and pass medial to the pubic tubercle. The direct arises through the anterior abdominal wall at a point medial to the midpoint of the inguinal ligament, and they tend not to descend to the scrotum. Indirect herniae pass through the deep canal, that is, they arise lateral to the midpoint of the inguinal canal, and they tend to descend into the scrotum. Femoral herniae, on the other hand, arise below the inguinal ligament and protrude lateral to the pubic tubercle, and they are seen more in females than males, and are more likely to obstruct. So this was a very brief talk looking at the femoral triangle and swellings in the groin, including clinical differentiation of the indirect, direct inguinal herniae and the femoral hernia. I hope you found this talk interesting. If you have any questions, you can bring them up in class. We talked about inguinoscrotal swellings and the femoral triangle in this talk, and in a previous talk we touched on the lumbosacral plexus. Thank you.